Hello, my name is Jack. I'll be your student nurse for today. And the doctor had ordered a Foley Catheter, which is just a urinary catheter that goes up the tip of the penis into the bladder to help relieve urinary pain. So to begin, I'm going to check your ID band. So could you state your name and date of birth? Alright, checking the computer to make sure everything matches up. Alright, good, Mr. Smith. So, do you have any allergies? No allergies, okay. And then do you have any known allergies to iodine? Okay, good. So, to begin, I'm going to put you down in a supine position and then raise your bed up to a working height. Okay, so I'm just going to spread your legs a little bit to have a better working area. Then I'm going to raise your gown to clean first. Alright, so I'm cleaning a circular motion and then the sides. Alright, so remove your gloves. Perform PPE again. And I take the bag. This box just has all the urinary catheter stuff in it. Alright, so I'm folding it to keep a sterile field. And then I would be putting on my sterile gloves, but these don't fit. So I'm putting these on. Alright, so I will put this cloth down to provide extra sterile field and to prevent leakage onto the bed. You just drop it, then you can tap it. And then the fenestrated cloth goes over the area of the penis just to provide more of a sterile field. Alright, just get situated. Alright, so I'm putting iodine on the cotton balls to get ready to clean. Drop that in the bag. Grab the forceps and do one clean at a time. So one swipe, and then start at the tip and clean upward. Drop. So now I'm ready. I'm gonna get the lubricant ready. So I'm going to place a little so I can get on the catheter 2 to 3 inches, and then I insert 10 milliliters of lubricant directly into the penis. Now I'm getting ready to do the urinary catheter to put it in. So I'm going to go ahead and put the balloon on, or the liquid for the balloon, which is just 10 milliliters of water. To help keep the balloon intact and prevent it from coming out. It'll go in. There it goes. Alright, so getting my lubricant ready, and in a normal patient I would go all the way down to the Y, but in a mannequin it will not go in all the way. So with my non-dominant hand, I would hold the penis in an upward position and insert the catheter, not forcing it. And that is the furthest it goes in. Then I can inflate the balloon with the 10 milliliters of water to make sure the catheter stays in place. And then give it a little tug to make sure it's in. All right. Now, I'm gonna put the urinary sac on the side of the table. And then I would tape the catheter to the thigh to keep it in place. And allow a little slack so it doesn't tug. And then taking a urine sample, I would get the capsule, unscrew the cap, make sure to not touch the inside of the cap. And then to drain it, you would unhook, unclamp, get your urine sample, whatever the doctor had ordered, clamp it up, and then reattach it to the sac. And then grab the capsule without touching the inside. Screw it back on, label it with your patient's name, date, time, and then send it off to the lab. All right, so the urinary catheter is in place. Urine is flowing through so that I know that it's in the correct place. Now I'm going to clean up. And then I would come back later to take the catheter out. And are you experiencing any pain? Okay, good. No pain is experienced. So I'm cleaning up. Throw everything away that I need to. And then I would put them in a comfortable position. That's going into the garbage. Put them in a comfortable position. Put their gown back, lower the bed, and then put them in a semi-phallic position to ensure comfortability. And then when taking out the catheter, I would come back in, raise the gown, make sure I have my sterile field. And this would all be placed. And then I would deflate the balloon. Oh, but before that, I would empty out the bag into a container to make sure all the urine is out of the sac. And if the doctor wanted to take a specimen from that, he could. And then I would deflate the balloon. Making sure to get all of the liquid out of the balloon so when I'm taking it out, there's no tugging. Then make sure so all the fluid is out of the balloon. Untape from the leg. All right, now could you hold your breath while I'm removing this? And 1, 2, and 3. Then I'll gather all this up and throw it away. So this is going into garbage. Garbage. Then I would lower, put the gown back, make sure they're in a comfortable position. Lower the bed. And then raise them to semi-phallic position to ensure comfortability. All right, Mr. Smith, the procedure is finished and that's it.